My name is David Vardy, and I'm your chair for the panel tonight, which is entitled A Dialogue on Social Innovation, New Approaches to Governance in Health, Education, Municipal Government, and Economic Development. This lecture is sponsored by the Leslie Harris Center of Regional Policy and Development. This is the third in the Memorial Presents series, the first of which was entitled The Atlantic Accord, Equalization and Offsets, an Independent Assessment, held February the 2nd, 2005. The second in the series was entitled Memorial Presents on the Fishery, Fishery Policy and Rural Revitalization, an Integrated Approach, held in May the 26th. We're holding this lecture tonight in the new Inco Innovation Center, the lecture theater, here at Memorial University. Tonight's lecture will deal with decision-making on key issues relating to healthcare, education, municipal government, and economic development. Government has recently announced new approaches to decision-making at a regional level with the announcement of new boards and new mandates. Several questions will be addressed here tonight. What is the effect of such new structures on the involvement of local people? Will these structures lead to improved services? And will they promote participation in decisions that affect people where they live? These are the questions, some of the questions for the panel tonight. This public lecture is being webcast tonight by the Distance Education and Learning Technologies Group of Memorial University. The lecture is being telecast throughout the province for people on the Persona and Rogers cable networks on the House of Assembly channel. People watching by telecast or webcast will be able to address questions to the panel by email. And the email address for people sending questions tonight will be research@mun.ca. I'll repeat that for the benefit of our television audience. That's research@mun.ca. Research@mun.ca. My introduction of the panel will be short because we do have a more detailed biography in the program, which is available to the people in the room. Dr. Stephen Tomblin is our keynote speaker. Dr. Tomblin is professor in the Department of Political Science and in the Faculty of Medicine at Memorial University. Following Dr. Tomblin, Joan Dawe will be speaking as a panelist. She is the chair of the Eastern Regional Health Authority and is former Deputy Minister in the Department of Health and Community Services. Following Joan Dawe, Dr. David Dibbon is Professor and Associate Dean in the Faculty of Education. Following David, Kelly Vodden is a geography student completing her PhD at Simon Fraser University. After the panel has finished their presentations, Dr. Robert Greenwood, who's director of the Harris Center, will be hosting the lecture this evening and will be moderating the question and answer period. Evaluation forms are available outside and along with a kit of maps, and these maps will be used in the course of the presentations. The presentations tonight will be available on the Harris Center website beginning tomorrow, and the URL for that is mon.ca/Harris Center. First, Dr. Tomblin will deliver his public lecture, followed by comments from each panelist. Then Dr. Greenwood will moderate a question and answer period. People watching on the webcast, as I mentioned earlier, will be able to forward questions by email, and I will address those questions to the panel. I'd like to now invite Dr. Stephen Tomblin to begin the evening with his public lecture. Dr. Tomblin.
First, I better get all my gadgets, because one of the advantages of coming to the Inco Center and this particular facility is we have lots of technology. And one of the things I have, of course, is a mic, which means I don't have to stand and provide you with just a lecture. One of the things that I'm most pleased with is that we have a diverse group of people within the room, Part of this, objective, or much of the objective, is to bring various people together to have a regional discourse, to talk about some of the challenges, some of the problems. We're a pretty small province, Newfoundland and Labrador, but we're doing a lot of experimentation with regions. There are various challenges, I think, associated with this, and there may be problems in terms of doing different things, promoting different objectives, trying to operate within different silos. And I think, part of what we're going to try to do tonight is to integrate, to learn from one another, to find out what we've actually built, what are the drivers, what are some of the constraints. So what I'm going to try to do, I guess, in the introduction is to talk a little bit about regionalization, provide a little bit of, I guess, of some of the theory, provide you with some of the sense of how this has occurred, why this has occurred, what we've produced, and where we are going. And then, of course, the other members of the panel who have a particular expertise as a result of their experience in education, economic development, or health. And again, everybody is experimenting in regions. And I will say a little bit about why that is occurring and what is some of the challenges and also, I think, some of the opportunities associated with some of the experiments which have taken place. That's me. Part of the reason I have been interested in this topic is because of the fact that I've been involved in different areas of research. That I'm one of those academics who is a bit confused because I'm interdisciplinary, which means that I get located in different departments, and people in different departments have different ideas. They have different ways of defining issues. They have different ways of perception, or kind of conceptualizing or thinking about reality. And each of these departments, of course, provide different ways of thinking about regions. All of the departments on campus have, again, a number of different frameworks or ideas and approaches which we can borrow from. And one of the advantages, I think, of doing some of the things I've done in terms of my research career is I've been able to think about regions, I won't say cross-provincially because I'm going to focus on Newfoundland and Labrador, but I've also been able to look at some of the kind of the experiments with regionalization in different policy fields. And again, I'll talk a bit about what has actually occurred and some of the challenges and some of the problems in terms of having a common perception, having kind of a common view of the problems, the challenges that we face in Newfoundland and Labrador, so that we can somehow work together rather in competition or in isolation. And I think that there is some problem. There may be problems of governance if we continue to do that. So I think there is a need for some kind of way of integrating, create new forms of interaction, promoting kind of policy learning, not only across the country, across jurisdictions, but even within the province itself. And I think that's part of what we're attempting to do today is to talk about the stories, talk about some of the kind of the drivers and some of the constraints so that we can learn from the past. So as you can see, it's very ambitious, and I don't see the guy who was actually timing me, so I do see you actually. But I will try to do a fair bit. And I will summarize, provide you with a kind of a historical context and also a sense of what regionalization is, what have been the drivers, what have been the constraints which have resulted in some of these experiments, what has been achieved, what have been some of the problems, what have been the outcomes. Looking at, again, as you can see, education, that we've had experiments in terms of integrating, consolidating, rethinking how we deliver health or education. Healthcare, in terms of, there's been a lot of experimentation since the 1990s. A lot of experimentation in economic development, the idea of development or regional boards, allowing communities themselves to kind of play a role in terms of defining their problems and coming up and constructing solutions and building support for that. Municipal government, there have also been, of course, pressure, not only here but in other provinces, but I won't talk about other provinces and other places, where there's a need to kind of come together to deal with the realities of globalization and the new economy, the challenges of the environment. I mean, all these are issues or problems which have created this, again, this desire to bring about change of ideas, change of processes, mechanisms, institutions, building new interests based upon these changes. Much of this has occurred, as we'll discover, in part because a lot of things were changing in the 1980s and 1990s. There was a sense of political or policy crises in Newfoundland and Labrador. Everywhere you looked, the circumstances were different. that the stories, the mechanisms, the way we looked at things, kind of the approaches we had in terms of defining problems and coming up with solutions, no longer seemed to make sense. The status quo had changed. We had, the problem of the national unity, the file, which of course Clyde Wells had to deal with. We had problems of, that changes in terms of continentalism, changes in terms of the underlying economic structure. We had changes in terms of movement to a new economy, movement away from a natural resource-based economy where fewer and fewer people are involved in the natural resource-based economy. All kinds of challenges or problems with deficits and debt, and questions raised whether we can continue to rely upon centralized approaches of bureaucracy in terms of dealing with some of these issues or problems. So there was a lot of pressure coming from below, changes in terms of the culture, changes in terms of people wanting to participate, increasing cynicism, all these other kinds of challenges, pressure from above, globalization, changes in the international economy, and so on. Outline what is regionalization. One of the things I probably will do tonight is completely confuse you. Regionalization, like democracy, like many other concepts, is contested. Regionalization has meant different things in different locations, has meant different things in different policy fields, because people have different interests, that different policy fields have different cultures. Academics have different cultures. There are different institutions, and there are different processes or mechanisms in each of these silos that we have built. So not surprisingly, regionalization is different in Alberta than it is in Nova Scotia, than it is in Labrador, and than it is in healthcare, and so on and so forth. And so there's a need to understand or recognize that. We'll talk about some of the similarities, some of the differences. Similarities like the need to cut costs, the need to involve the local community in terms of defining problems. These are kind of common. The models, the visions, the values might be quite different. In the area of health, the focus might be much more based on need. In the area of economic development, it might be much more focused on efficiency. So you have one region which is really trying to get people out, or they're trying to increase mobility. In the area of health, you may be having to focus on need because you're trying to reduce the cost of healthcare and have a preventive approach, a more community-based approach. So in many respects, the approach, the values, the vision, the visions that are competing for influence or power within these various silos may be quite different. And these are, again, significant differences. What are the policy lessons? We will see. Part of the difficulty is that there isn't really much discussion, much opportunity to kind of construct common knowledge based on experience, because we tend to operate, academics tend to operate in separate silos, but so do different departments within provincial governments, federal departments, and so on. As I suggested, I'm going to focus on the experiments with regionalism and regionalization within Newfoundland and Labrador. Although I must make at least this point that regionalization is alive and well in New Zealand. It has been in the 80s and the 90s. Regionalization was very popular at the cross-provincial level, which took place mostly at the executive level, and the objective was to promote integration across jurisdictions. And of course, this sometimes worked in opposition to the devolution of power at the community-based level, because that was creating diversity, and the more diversity you created at the local level, the regional level, the more difficult it would be for premiers, if this was actually occurring, to integrate and to use their power to kind of move in common directions to promote some form of convergence. Now that I've kind of moved away from that, I'm trying to figure out, and I think we need to understand some of the contradictions, some of the differences which are occurring within some of these regional experiments, and some of the outcomes that may or may not be coming out of it. Innovation, regionalization is based on the sense that the current system is not working. It's incapable of dealing with the problems, either external or internal, or at the grassroots level, and there's a sense that there is a need for fundamental change. So part of, obviously, the driver is the sense that the status quo does no longer work. When Clyde Wells was going around talking about, the need for a new health system, he's talking about the costs, he's talking about involving local people. When he was talking about municipal restructuring, when he's talking about economic development boards, and he's talking about all these various experiments, part of the reason was there was a sense that the status quo didn't exist. And these prevented or created problems, but they also created opportunities. Opportunities for experimentation. People who were in positions of power had less power, that they couldn't kind of defend the status quo in the way that they could in the past. So there was a lot of changes and a lot of questioning of ideas and institutions and interests within the system from the late 1980s to the 1990s. There are different ideas about how you should affect change or how you should bring about change. Political science, there's a lot of discussion about incrementalism versus long-term planning, that you bring it about by a big bang and you throw everything away and you replace it. That is easier to achieve, and there's certain advantages in doing that, but there's certain disadvantages. If you blow away all the doctors and you're going to have somebody else deliver the services, or if you're going to really piss them off and you don't have the expertise to actually know what to do, that's a challenge, that's a problem. If you replace a government and the bureaucracy and you come up with a whole new approach and you don't have the people with the skills to actually continue to move, to move forward, that's a challenge, that's a problem. Incrementally, of course, there's other advantages and disadvantages. William Coker had a lot of ideas about reform. Once he became part of the inner crowd, many people suggest many of those reforms were lost. So incrementalism brings with it certain dangers, that you may not be affecting change at all, that if you put the stakeholders in place who have power and have an interest in not really transforming the system, they may entrench themselves and you really won't affect change. So there has to be, the choices that are made, but there have been lots of discussion about whether you need a big bang and destroy the biomedical model or change the power of the doctors or the power of the drug companies or the power of corporations or what have you and replace them. But there's been a lot of discussion and a lot, I guess, that hasn't really been decided. There's no real consensus in terms of what is the best approach. Centralization, I mean, part of the problem with regionalization, it is both about devolution of authority, from the province down to the region. It is also involving consolidation of power. That if you build a health region, it may result in the closing down of a lot of rural hospitals, for example. If you create another region in terms of economic development, that may also may consolidate power. We know that in terms of even the most recent change in terms of the health authorities and so on, that you're trying to centralize, you're trying to provide capacity and autonomy so that the regions are able to do certain types of things. But the challenge is that some of the people may not feel connected. There may be challenges associated with that consolidation of power. There's also, of course, various challenges in terms of citizen participation. Some of these things are rather complicated, which I'll talk a bit about in a minute or so. First, I want to kind of talk about some of the objectives. As you can see, there are a number of competing objectives associated with regionalization, which makes it difficult. It makes it difficult sometimes to sell, because people in the communities are saying, are they actually going to improve the quality of service, or is this really a way of downloading responsibility because of the deficit problem or because of globalization? Is this really kind of a way of getting away from making a very tough decision politically, and you'd rather have the school boards make the decision, you just cut the budget? That these are things that really make it difficult for people to get excited about buying into having to play a direct role in terms of defining health problems or economic development problems or dealing with the educational system, because there's a sense that they're going to lose. And of course, there might be differences also between urban and rural areas, because there are differences in terms of the capacity or the ability to actually make a difference. That if this is based on volunteerism and providing, again, local support and having local people play a more significant role, that is, of course, a challenge that can be a problem. So there is, even though the intent might be to do a lot of different things, those in politics are always really forced to kind of make compromises, to do a lot of different things at exactly the same time. Regionalization can be sold in a way that is rather ambiguous, in the same way that democracy or the just society can be sold. But of course, that makes it difficult to build a strong coalition support. Sometimes it makes it difficult for people to buy into it. It also makes it difficult for the defenders of the old system to really kind of, take the opportunity to allow this kind of challenge to their power to take place. Bringing about or affecting change requires the sense that there's a crisis, there's a need for change, that we need to have a common perception of the problem. We need to pull together. We need to build a strong enough coalition in support of it. The problem with having all of these objectives is that it may be difficult getting everybody to agree on what the objectives are or what they should be. The other problem, I think, with many of the visions which are presented in each of the different policy fields is that you have quite different frameworks or models that are being proposed. And health is quite different, I think, in terms of the focus on equity as opposed to efficiency. The environmental regionalism would be based on, again, a different set of values, a different set of ideas, different perceptions, different interests as well. And it makes it difficult sometimes, I think, to build a coalition in support of these kind of this common goal or objectives, which are by their very nature competing. Regionalization and democracy and citizen participation, that part of the rhetoric and maybe part of the reality is to allow local citizens to play a bigger role in terms of defining their own problems. And the problems like Newfoundland and Labrador, the nature of the economy is different, the health problems are different, and sometimes it makes sense allowing people to actually solve their own problems and define their own problems. And of course, if they're excited about it, they actually may be able to pull together and they have a common sense of what needs to be done, and they may have a kind of this determination that we will pull together. This, of course, can be done if there is the right set of circumstances and people feel that it's worthy and it's worth doing. But there are other challenges, I think, associated with this as well, that departments may not want to give up that power. They may be concerned about some of the differences between rural areas who may not have the volunteers, who may not have the capacity or the ability to do that, and so on and so forth. There's also problems in terms of the structures or processes which we have built, because they're by nature complicated. Anybody who looks at the maps, as we'll find out earlier or later on, there's a lot of different regions. There's a lot of different processes and mechanisms. It's difficult enough for the citizens to understand what is going on in terms of municipal politics. It's more complicated to figure out what all of these structures mean and how they work and how they get access to the information, what their objectives are, and so on and so forth. It also creates this regionalization by its very nature, creates diversity. That, of course, makes it difficult to have a province-centered view of the problems that we are facing as a community. That's a challenge for any premier. That's a challenge for anybody who's trying to build a coalition in support of a province-centered approach, building a sense of cohesion, and so on. That's another problem with regionalization. The other problem with regionalization is that they may work at cross purposes. As I mentioned before, executives working at the cross-provincial level, premiers who are trying to integrate and promote convergence will have a problem having systems which are devolving power and creating more diversity. You will have problems across regions if some of the regions are putting the resources and their priorities on need, and other departments are putting their emphasis on increasing mobility and not spending in areas which are considered areas of poor investment, that the money should be spent in areas where urban areas where you can form these regional clusters and you can create opportunities and advantages and so on and so forth. Another problem, of course, with citizen participation, there's a sense that they're downloading blame to the education boards, so they're downloading blame to the health authorities who are having to shut hospitals as opposed to politicians shutting hospitals. This makes it difficult for people to buy into the process of change. Many communities, they're winners and they're losers. Some communities don't feel that they're going to win in this game, that they can't compete with St. John's, or they can't compete with Halifax, or they can't compete with Toronto. These models were designed for, based on the thinking of certain economists who are in Toronto, that they're looking at these things based on their experience, based on a particular context, based on some of the literature which has certain built-in biases. The problem, of course, is that there may be challenges in communities where all the young people have left and they people there don't have the time or the skills or interest in terms of engaging in the way they might in more urban centers. And this, of course, adds to the problems of cynicism and so on. Quickly, in terms of there are different ways of organizing regions. Some are appointed, some involve direct participation or election. There's, again, in this province, there's a mix. And there's quite different ideas, as one would expect, on whether they should be appointed or whether they should be elected. The advantage of appointment is that you can make sure that there's certain stakeholders that are participating, that doctors who know the system may be part of a regional structure, but most of the regional structures in Canada have not had doctors directly involved because there's a concern that they will take it over. But of course, there are disadvantages in having them involved because they operate outside these regional structures. There is also concern sometimes about gender representation, or ensuring that certain groups are represented, and an appointment allows you to ensure that those issues or that particular way of thinking about issues will be reflected in the people who are sitting within the board. One disadvantage, of course, it may be used as a vehicle to reward friends, and that doesn't really produce or achieve better outcomes. Again, there's certain disadvantages in terms of having legitimacy and support, in a sense that this is ours and that we benefit from this, and it doesn't engage the public. On the other hand, even provinces who have tried to have elections, even in Alberta, have found that people haven't really engaged themselves into the process. They haven't voted in the same way, I guess, people talk about municipal politics, and that there's a problem if you don't have the right people running, and if there's no kind of interest in it, then it's a problem. And it has been a problem, and many of the health authorities have kind of switched back and forth. Affecting change requires a lot of things, a lot of ducks that must line up. You have to have a vision. You have to have a new way of thinking and defining reality. You have to have a way of conceptualizing that reality. Everybody who is involved in regionalization has some kind of vision. In health, it's kind of community-based approaches, prevention, health promotion. And there's various kind of competing ideas, but it has to do with this idea that you need to change or challenge the biomedical model and replace it with something different. And the regions and the regional structures and processes can actually allow you to affect those kinds of changes and to challenge the power of kind of those who are in representing or defending the biomedical approach. That doesn't mean that you can't bring it about incrementally. You can't bring the doctors and change the educational system and all of that kind of stuff, which is all very positive. But it's based on first creating a sense that there is an alternative. The Liberals in Canada have been able to survive in Ottawa because there hasn't been an alternative. There hasn't been the leader who has the vision, who's capable of convincing people that he can actually provide an alternative framework, an alternative way of doing things. That, of course, is important for the change, whether it's incremental change or whether it's more fundamental change. The other thing is you need to build some kind of coalition in order to institutionalize it. And the problem with regionalization is it's not really fully institutionalized. It's in between, and that's one of its advantages. But the problem is that it really doesn't exist in institutional form. It relies upon others to drive it. And part of the problem, of course, is that you need to build, you need a crisis big enough in order to affect coalition. You have to build a coalition in the same way that Stephen Harper was hoping that he could have a crisis, and then he thought he had the Liberals, and he had everybody was outraged, and he had to basically just sell himself in the party and present this case that he had an alternative. Affecting that kind of change and bringing those kinds of conditions are difficult for a variety of reasons. Getting a new vision to get institutionalized and replacing or changing is a difficult thing. As we said earlier about William Coker, he knew this. He had certain choices that had to be made. Anyway, I'm going to finish off, now that I've probably completely confused you about what regionalization is, and I've tried to explain that there are different ways of, or there are different experiments in regionalization in different policy fields. I want to provide you with a very brief kind of overview of some of the experimentation that has taken place and some of the different decisions that have been made, and the panel will discuss some of the outcomes that were achieved. Education, education reform, started off kind of incrementally, and it really became big bang change, in part because the politicians couldn't achieve what they wanted, which was to replace the power of the church or change the curriculum or change the system based on the requirements of a global economy with a new economy where human resources mattered more than natural resources. Again, part of, I think, the reason it was able to implement it successfully in our province had to do with the fact that it wasn't just external in terms of some of the pressures in terms of reorganization of the education system. Part of it also had to do with the fact that there was a lot of discussion within the province, that there were attempts through these various regional or these commission studies. In Canada, we don't rely upon political parties as agents of change. We tend to rely upon commission studies, whether at provincial level or national level. But there was an attempt to create a new vision based on a new set of priorities, based on the sense that there needs to be a change in terms of the values and how the program was delivered, that we were to produce students who were capable of adjusting to the realities of the new economy, and we could not continue to do things in the way that we did in the past. And there was, again, the sense that we are now in an era of post-industrialization, where the structure of the economy has changed, the realities have changed, and there were a couple of studies that made it easier to kind of sell and convince and build a coalition around this idea of change. Originally, again, this is the 1990s, early 1990s, everything has collapsed. The cod fishery has collapsed. The whole reason we were here was gone. That there was change in terms of the fiscal problems. There was a sense that there were opportunities. There was a need for change. There was a need to move in a different direction. Clyde Wells understood this and decided that he needed to use these opportunities in order to effect fundamental change. One of them, of course, had to do with ensuring that there was a public school system, that there was a system capable of dealing with the problems and the challenges associated with the new economy. And human resources mattered. And first, he tried to kind of do it incrementally, and as did his predecessor, Brian Tobin. And of course, they tried to work it through in various ways. In the end, what happened is we had the referendum. We did it for the children, and there was a significant shift in terms of the movement away from the church as the institutions that were delivering and providing support for education to a public system, which required a constitutional change and all of that. But again, that approach was first incremental, and then we had what was a big bang, but justified through a referendum. We also had a lot of discussion about the need for regional development boards, this idea that we need to restructure the province based on the new realities. And of course, the idea was we will engage the communities themselves, because who better than the communities themselves to decide what they wanted, what their priorities were, and which direction that they would like to take. This, again, was influenced and supported and was helped by a process of decision-making and discussion and consultation, including, again, the Economic Recovery Commission, these various public meetings. It was sold, it was discussed. Some of the concerns of the public were addressed. They came up with, again, this idea of economic zones and strategic economic plans and so on and so forth. This, of course, resulted in supposedly all of these changes, better citizen input, opportunities for local communities to define issues for themselves, to reflect the diversity of the province, better coordination, integration through these various mechanisms, which again reflected the kind of new realities of Newfoundland and Labrador, based on the kind of theories of regional clustering, and that the ideas of Porter and others who thought this was going to be beneficial for everybody involved. Regionalization of healthcare. Regionalization, you can trace it back to the Smallwood era, go back to the Brain Commission. We defined region as an area that was able to sustain a hospital, provided enough patients and so on for a hospital. It's been around for a while, but the 1990s, again, partly because of the fiscal imperative being a driver, but also much interest in health promotion, much interest in prevention, increasing costs associated with health care, other professions besides the doctors who were concerned, even changes within the medical profession itself as a result of more women in the profession and so on. So there was a lot of changes which are occurring. What you had, of course, was 1990, kind of the beginning of this discussion. Wells started off by having really a discussion with some of the stakeholders, including the church, and was very effective, I think, in terms of that particular experiment in regionalization was pretty effective in terms of getting support. He also had national support frameworks which he could rely upon and resources in order to kind of explain or justify or legitimize some of the changes which were occurring. Saskatchewan, Ontario, Alberta, everybody seemed to be jumping on board. Well, not Ontario. Ontario was the only one that wasn't experimenting, but certainly the restructuring was taking place. And there are, again, several strategies that were associated with this, or justifying some of this change, the focus of reliance upon a population health model and a community-based approach, a different vision, a competing vision, and a coalition of interests that could be used in order to drive it. Again, these are some of the advantages that it was, going to reduce costs by shutting down hospitals. It would increase, the ability to attract specialists by having a bigger area, so you could improve the technology. You could increase the quality of care. You could provide more specialized services, which would increase capacity and autonomy at the regional level. You could deal with waiting list reform. You could deal with various other issues that were a problem, and people just up to that point did not have access to that kind of capacity. So those were some of the advantages. Some of the disadvantages is some of the people in communities may have felt closer to the rural hospitals. They may have actually known the people, and so there's kind of a disconnect for them. There is, of course, a problem. And one of the difficulties, I think, in terms of regionalization or regions, and again, talking about silos, is in the province, really, the economy is so much impacted or influenced by changes in the healthcare system. Healthcare system is part of the economy. It's a big part of the economy. It's a big part of the provincial budget. But we often tend to see it as separate. And there's a need to integrate these things in the way that Quebec has or other jurisdictions have. But there were challenges associated with making decisions having to do with too many rural hospitals. This was the case in Saskatchewan, but this was also the case in Newfoundland and Labrador, and some of the problems in terms of the economy, of course, other challenges with the collapse of the cod fishery, and of course, if you start shutting down hospitals, which are highly significant, this was a problem as well. These were the regional health authorities that were established. These were the structures that were in play. We know recently that these have been downsized to 4. We'll hear more about that in the panel. Municipal government, which Peter Boswell was here. Municipal government was another area where there was a lot of interest in kind of integrating, consolidating. This was not just here, Halifax and across the country. There were similar pressures in terms of the new economy required, these powerful regional structures, this clustering. They must build these partnerships. They must deal with all these issues or problems. They must increase capacity. Must increase the autonomy of the cities. With the city's agenda, this is increasingly a challenge or problem. And there was this kind of need to integrate rural and urban areas, to provide kind of common approaches to the environment and so on. Finally, the task force on regionalization came up with certain ideas in terms of where they wanted to proceed. Much of this, of course, did not come into being. Anyway, I'm almost at the end. Similarities. I didn't watch you, I guess. I didn't get the end of it. The similarities, I mean, there are certain common objectives associated with regionalization. One is, of course, the reduction of costs. One is, of course, the improving management, improving efficiencies through some of these structural changes, increasing capacity for local communities to define issues and solve issues themselves, improvements of access, and so on. Key differences, I think, have to do with the fact that they're quite different models and frameworks which are in play. There is, of course, differences in terms of whether they're elected, whether they're appointed, differences between the school boards and the health authorities, for example. Consultation, some areas there was more consultation than others. Health seems to be an area where there's a more positive perception. Municipal government, especially in Mount Pearl, has been a real challenge in terms of integrating and bringing about certain regional structures and processes and putting them in play. I guess, you know, as I'm going to kind of finish off here, I think, is that regionalization occurs, or you know, major changes occur when there is a crisis. We had a number of problems or challenges in the 1990s, and so that explains in part why there's so much experimentation that was taking place. There were a lot of different ideas and different silos that were operating. There have been challenges with getting the public to buy into it, particularly in municipal areas, but other areas as well. There are challenges associated with the kind of the devolution of power, and the sense that the province is stepping away from some of these responsibilities and making others do it. In terms of the policy lessons, I guess I'll kind of finish off on this, is that I think one of the biggest problems that we face is that we have had so few opportunities to even to discuss some of these experiments, to actually know what are the key lessons, what are the drivers, what were the constraints, what were the outcomes that have been achieved, what did it improve health, did it improve the economy, did it reduce costs? These are or what could we do to ensure that the public becomes engaged or feels like getting engaged? Is there some key lessons? Are there some best practices in regionalization that we could learn from as a result of comparing these things? That is not me. I'm Stephen Tomblin, and I am finished. And people are saying, thank God. And here is Joan Dawe.
Thank you, Stephen. It was Dr. Stephen Tomblin, the Department of Political Science, who's just given us an overview of issues relating to regionalization and set the stage for the panel discussion which is to follow. We're now going to move into sectors. We're going to move into the key sectors that are impacted upon, beginning with health. But for those of you on the telecast and webcast who have just joined us, I wanted to let you know that you are watching the Memorial Presents presentation from the Inco Innovation Center tonight, and the subject is regional approaches to decision-making in health, education, municipal government, and economic development. And those of you who are intending to contribute to questions for our question and answer session, I want to remind you that the email address is research@mun.ca. Now, very briefly, going to introduce our first panelist, Joan Dawe. Joan is former Deputy Minister of Health and Community Services, and she presently is chair of the newly created Eastern Regional Integrated Health Authority. I give you Joan Dawe.
Thank you very much, David. Good evening and welcome. It's wonderful to see so many familiar faces in the audience to begin with. And I want to thank the Harris Center for the opportunity to participate in this very, very important area of collaboration. And I hope to be able to demonstrate to you within the next 10 minutes why I believe in this so much. Thank you as well, Stephen, for setting the stage for us. Now I need my advancer. Okay. I want to say, though, at the outset that much of what had happened through the 1990s, and actually as we move in now to the 2005, occurred because we heard a great deal from the community at large across the Newfoundland and Labrador through the consultation process which developed the Strategic Social Plan in the mid-90s. Many people told us of the need to better coordinate within our areas and across the areas, the importance of early intervention, prevention, the importance of community-based services. So I want to give credit to all those who participated in advising us in the mid-90s, and hopefully we're carrying out some of their wishes. I want to now bring us into 2005, and that is what I consider the next phase of regionalization for the health system. As Stephen had mentioned, there were 14 boards in the health system in the 1990s as a result of one wave. This is seen as well, I hope, at least for a number of years, to be the final phase of complete integration of the health and community service system. And as you see there, September 2004, government, through the Minister of Health and Community Services, announced the changes, the new direction for the health and community service system. And you see there the common policy areas that were identified earlier, creating fewer boards, more accountable authorities would meet the needs of the public, less administration, of course, cost issues again, improved collaboration, integration, improved services. So they're very, very much common themes that have been with us since, at least since the 90s, but I can go back to the 80s where much of this was a concern as well. This is our new structure. So this represents the 4 integrated health authorities in Newfoundland and Labrador: Eastern, Central, Western, and Labrador. Now, Labrador board covers the tip of the Northern Peninsula as well. You see the corresponding populations that we serve. For the rest of my presentation, I'll concentrate on the Eastern Authority, the board that I'm associated with. I'll not presume to speak about the rest of the boards, although I want to tell you the principles are the same across the province. But I'll concentrate my efforts on the Eastern. You see that then we are responsible geographically for the Avalon, the Burin, and Bonavista Peninsulas, and we cover out as far as Port Blandford, all the health and community service areas. The Eastern Authority now provides services that were, up to this year, provided by these 7 boards. Okay, so 7 boards integrated into the Eastern Authority. Let me turn for a moment to the mandate of the Eastern Authority. It really is multidimensional. You hear mostly about our mandate for the provision of health services to the community. But we also have a very strong mandate for education, education of professionals, continuing education of professionals, and a very strong research component as well, health-related research across. We have regional responsibility for the full continuum of health and community services. So that covers from the public health services to all the community-based home support, home care, intervention, prevention, the institutional acute care and long-term care system as well. So we provide these services for the full region. Then we also have a provincial mandate for the specialty services that are only provided out of the St. John's area: cardiac surgery, neurosurgery, cancer treatment, and the like. So as I say, it's a multi-dimensional mandate that we have. Okay? Thank you. Maybe I'll go to this side then. It is a very large organization, as you see. We have 18-member voluntary board, which is appointed by the Minister of Health and Community Services. $850 million operating budget annual. If you factor that down, that's about $2.3 million a day, George, I think that we're responsible for. 12,000 employees in the area, and 27 healthcare facilities and 30 community offices. So that's a quick overview of the mandate. Let me move along. I think one of the key messages that I want to convey this evening is that our approach to program and policy development is based on a population health focus. We're very, very concerned about factors that impact upon health. We know that the health system in and of itself does little to maintain and improve the health status of the population. We also know that in Newfoundland and Labrador we have some of the highest rates of preventable illnesses in the country. You know the incidence of diabetes, heart disease, and cancers, for example. So it's critical that we start thinking about prevention, early intervention, and that's what the population health focus is all about. Base our decisions on evidence and facts, and we have a great deal available at our disposal. The upstream, the early intervention, prevention pieces, collaboration among and across the sectors. That's why I believe it's so important for us to be here this evening, to be understanding the impact that we have across the sectors between, certainly among health, education, the economy. You just think of poverty and the importance of all of these factors. The need to employ and engage the public at large in the discussions. That's all the population health focus. That is very, very critical for us. If we are to affect change in the health status of the public, we have to start thinking outside the box and concentrating on these factors and working with our colleagues across the sector. There are many challenges, no question, as we move along with this phase, another phase of regionalization. Let me just focus on one or two of these. Creating the new organizational culture, and that's the thinking outside the box. It is a challenge. We are moving in that direction, but it is a long road to have us all thinking the same here. Maintaining the stability through the reorganization. I indicated earlier we are integrating 7 organizations in the one. You can just imagine what that means. We have one of the best, if not the best, president and CEOs in the country leading this. But it's a formidable task to create this organization. We know from a public point of view, the public wants timely and appropriate access to quality services. We have that mandate. On the other hand, we have 12,000 employees, many of them who we know are very concerned about the changes that are occurring, how it's going to impact upon them. So it's important for us to be very cognizant of the concerns as well of employees and how we factor these in and engage them in the discussions as we move along. Stephen mentioned earlier the urban-rural issues. We've heard already as we work our way around the region of concerns of parts of our mandate and the communities about what's going to happen. Are services going to be centralized in St. John's? Are they going to have to travel further for services and so on? These are real issues that we are working with communities to help reassure them that our objective is not to dismantle service, is to enhance and improve services, but maybe we have to find different ways of delivering these services. However, while there are challenges, there are many, many opportunities that are available to us to focus on improving the health status. That's our mandate, and that's why we're here. No question there are opportunities to improve that balance between preventing illness, promoting health, and providing care and treatment. We're not going to any way diminish our responsibility for enhancing care and treatment, but we have to improve the balance along the continuum if we are to improve the health of the population. You can see, I need to move on because I'm afraid that hook is going to pull me from the floor, and I want to move on to my last slide. But we have opportunities to address gaps through the reallocation of resources as well, now that it's the one organization. We know there are needs in the community. We hear about mental health and the lack of mental health services in the community. We're hoping to be able to affect some of these changes through reallocation and additional resources there. Let me finish now to speak a little about governance, because I think this is critical as well. I believe and I hope that government actually acknowledges the very valuable role that as volunteers we contribute to the community by being engaged in governance. I'm not sure, however, that government, or actually many of us who accept these roles, truly appreciate the significance of the mandate that we've accepted. It's a horrendous task, requiring a great deal of time and expertise and commitment to the process. So we are very, very much aware that there are two pieces of legislation that are guiding the governance of our organizations. And that's a Regional Health Authorities Act, which is under development, and we have an opportunity to have input in there. A Transparency and Accountability Act that has not yet been proclaimed, but we expect that within the coming months. This is a very prescriptive piece of legislation, and there are a number of policy documents with that as well. That specifies a strategic planning process for the boards, presented to the minister, must be approved by the minister, presented in the House of Assembly, annual reports to follow with identification and explanation of variances and the like. So we have a heavy responsibility that's mandated through legislation. Finally, I want to just indicate to you that our board has chosen, even though we just assumed our responsibility April the 1st passed, so we're about 7 months into our mandate, we've chosen a policy governance model as opposed to the more traditional governance model, because that is very consistent with the legislation and consistent, I believe, with our mandate. Many of you have been engaged in boards before, and you know that the traditional model where trustees not only developed policy, but carried them out and were more involved in the operations and management of an organization. We've moved considerably over the years away from that model, and much more now to policy governance, where we will be developing policies and processes and spending our time on monitoring the implementation of these, looking more to the outcome and monitoring the outcome. So it's a new way of doing business for many people. We have engaged on a year's process for an orientation of our board members, so understanding clearly our roles and responsibilities, developing our strategic plan, which we hope to have in its near final stage by December coming, and engaging on a facilitated policy development or policy governance process for the next 6 to 8 months to assist us in transition. Our vision, and I'm sure you would agree with me, is that we're going to be working together for healthy people and healthy communities. And I believe that's why we're here tonight. And I look forward to continuing the intersectoral type of collaboration to help us achieve our vision. And finally, I had a final. I guess it's gone. My final was it was a caption of Gross Morn. The sky was very, very blue. The trees were down here in very forest area, and I'm saying, I believe we're down there among these evergreens and in the forest. Though looking up, the fog has lifted. It's a beautiful blue sky. So we know where we want to get, and that's to the top of that mountain. So I look forward to continuing the journey with you people as we go through that forest and reach the top of our mountain in the health of people. Thank you very, very much.
Thank you, Joan. We're going to enjoy that climb up to the top of Gross Morn. We thank you for giving us such a comprehensive overview of the massive changes that are taking place in the healthcare sector and highlighting the important linkages from one sector to the other. And that is going to be exemplified now as we move into education. Our next speaker is Dr. David Dibbon, and David is Professor of Education, Faculty of Education, and Associate Dean of the Faculty of Education. So now I'd like to call upon David Dibbon.
It was there when I left my seat. Good evening, folks. It's getting late and I'm getting tired. I have 2 children, a 4-year-old and a 2-year-old, who seem to specialize in waking up at 2-hour intervals, which sort of cuts into the evening. So if I look tired here tonight, I am, because I've been up like every 2 hours for the past number of nights. And at 7 o'clock this morning, my oldest daughter, Catherine, wakes me up and she said, "Dad, have you got to be on television now?" And I said, no, Catherine, it's not this morning, it's this evening. And my point being that it is late. I'll try to stick as much as I can to my script here. But if I catch any of you guys falling asleep, you got to buy me a drink afterwards. And if I fall asleep, I'll buy you a drink afterwards. So that's the deal that I'll make with you. So we're talking about the impact in education, really, is what I've been asked to address today. And the concept of regionalization, I mean, I guess I really question whether or not, Steve put up a slide earlier and talked about regional decision-making, and it's questionable as to whether there has been a lot of regional decision-making in this new era in education in the province. I think regionalization is a very valid concept. Nationally, I think it's alive and well. Many of the people, though, that I spoke to in trying to prepare for this from rural areas of the province and representing people in rural areas of the province kept asking me or kept questioning. He said, you know, the concept of regionalization, as valid as it may sound, they said, I think it works better when you have higher concentrations of people. And that taking a concept like regionalization and trying to apply a model that's been used in different parts of the country to a sector like education in Newfoundland, you really have to think it through first. And they were questioning as to whether or not that thinking through had really occurred. So they were very, very cognizant of the fact that we do need a new model. We do need to look at change. The status quo is not acceptable, but there was a questioning as to how much thought has actually gone into it. I just okay, let's try to get it right. That's just a map. That's in your package there as well. But, and I think the reason some of this was questioned was simply because basically this has been, and I'm going to pick up the whole regionalization concept from 2004, you know, because within the education community, I think there was a fair degree of acceptance and understanding of the whole notion of consolidation and regionalization and regional government within the existing structures that existed before the last provincial government. And one of the concerns that was addressed is that the decisions that were made were basically fiscal decisions. I mean, this was a fiscal decision. It wasn't based in pedagogy. It wasn't based on any sound educational ideology. As it says, as you read there in the second last line, it was reducing the boards from 11 down to 5 was about to save $6 million. And that was really the purpose for it. And I guess it's questionable as to whether or not they've actually really saved that amount of money. And I didn't see any evidence, and still haven't seen any evidence, that there's really been a very sound cost-benefits analysis done. And Joan talked earlier about evidence-based decision-making. Well, I just don't see a lot of the evidence that went into making this decision. And I guess I and some of us would question as to if you were talking about a medical metaphor in terms of whether or not there might have been a few too many amputations before the diagnosis has really come in. You know, I mean, it's been sold as an item that wouldn't negatively affect the classroom or have an impact on the classroom, and I think we know that to be true. Anytime you remove the resources from the classroom, you're going to have a negative impact, and this has. And so I guess my point here is that in terms of education and regionalization, and talking about regional decision-making, I'm not convinced that it's evident. And what I'm seeing more of is the fact that I think we're living really in an era where we're in an era of mandated change in Newfoundland. And maybe it's a transitional phase, and that's fine, where we find that really we know from research, and we know from many of the fine researchers in the world on educational change and other change, that you can't mandate what matters. You can mandate the technical stuff. You can mandate that there's going to be 5 boards. You can mandate that people are going to come to work at 9 o'clock, and you can mandate that they're going to work 5 extra days a year. You can mandate as many of these things as you want, but you can't mandate the important stuff. You can't mandate that you're going to care about your job. You can't mandate that you're going to be positive in your work. You can't mandate that you're going to have a positive influence on children. Those are very, very difficult things. Those require changes in attitudes and changes in belief. And if you don't get that, you're probably not going to see it manifesting itself in productive change within the system. And some other research that I've done in the previous research, when you ask teachers how they feel about their job, 50% of them tell me, I wouldn't recommend this for my son or daughter or for the best people in the class. And that's kind of frightening when you think about education from my perspective. But we do know that mandates can work if they're supported. If they have the proper amount of supports and resources behind them, they can work. As a matter of fact, there's some advantages to them. The priority is very clear. The expectation is very clear. And again, in a transitionary phase, there's some advantage to it. The problem is, though, if the only support that it gets is while it's in its developmental stage and not in its implementation stage, it tends to fall down. And the support needs to come up front. It needs to be proactive and not reactive. I mean, proponents would argue, I suppose, that there has been some support injected into the system recently. That would be reactive. It's been there because right now we're almost in a crisis situation within some of the districts. So I don't really think there was a choice but to infuse some funds. Regionalization. Regionalization, I also think it's been treated almost a little bit too easily. It's been treated as a fairly simple proposition and a pretty simple change, when in reality, it is a very complex topic. It's a very complex concept. I mean, from a school board perspective, you're looking at staffing and how staffing is done. You're looking at communication patterns from St. John's to Buren to Bonavista. You're looking at relationships and trusts and learning who the people you're supposed to be working with are. You're talking about reculturing a system. Reculturing an educational system probably takes you 5 to 8 years. And I remember speaking to Brian Shortle, and this was very recently. And Brian basically said, look, you know, this was before the newest round of organization. And he said, you know, we're finally getting there. We're finally getting to the point where we can get back to the learning agenda. We've gone through this consolidation, this reorganization point. And, I mean, if you talk to him, and if he were here tonight, he'd say, we were just making the turn, and all of a sudden, we're restructuring again. And it's going to take us another 5 to 6 years in order to get back there if we stay on the current road. Geography. I think geography plays a tremendous impact in this province. There's no doubt about it. And I think the regionalization piece works an awful lot easier if it's generated from the grassroots up. If the energy is flowing from the communities up who are saying, yeah, we need this, and it's going to work a lot easier. Now, as I said, I really didn't see this in this round. It seemed to be more top-down. In terms of what some of the impact, or what the impact has been on the education system, can I go to my next slide? Is it in there? Oh, shoot, I'll put them all up. Next slide. Loss of resources within the system. I mean, the yellow slide there is 94, 95, 10 years ago. Right? And the blue slide is what it is right now. This is board office personnel, people who work in district offices in Newfoundland and Labrador. And yeah, there's less schools now. And yes, there's less students, and yes, there's less teachers. But you know what? There's still a heck of a lot of demands. And previously, school districts were always a resource center. They were resources, particularly, I believe, in rural Newfoundland. And when you take those resources out, be they human resources or physical resources, there's going to be an impact on the system. And I think we felt that impact on the system. And I'm just going to go back, talk about district office. And I live and work here in St. John's, and I'm quite familiar with the Eastern School District. And I'm quite familiar with the exodus of senior level personnel from the Eastern School District Board office this past summer. And it's kind of scary, to be honest with you. And it's saddening, and a lot of people are disheartened by it. As one person said to me, he said, Dave, you know, there's a lot of good people who aren't here anymore, and that's no reflection on the people who are there right now. It's just that we've reduced our capacity. They said they talk about a lot of overworked administrators. They talk about working in support services. They say, when I get 15, 20 calls from a teacher a day, I can't return them all. I can't provide the services that I'm supposed to be providing. So I asked the question, how come people aren't more vocal? Because basically the community's been silent on this. And they said, well, basically there's two reasons for it. There's this new dual accountability model right now, which says that, you know, senior CEOs and directors are responsible not only to the public, but also to the Confederation Building or to the Department of Education. And speaking out against your employer would be insubordinate, so I think there's a certain fear factor. And even within people who are not at those ranks, there's also somewhat of a fear factor, because a lot of people who would be vocal aspire to move into those positions. So there's been a real sort of pall over the whole area. But teachers will tell me it's not quiet in the schools. Come into the staff room and you'll hear about it. School administrators, Reality, school administrators, I have to hurry up. School administrators, they don't have enough time to do the instructional leadership. What they're forced on doing is bureaucratic administration. Teachers sort of around change overload, burnout, loss of self-efficacy. And what's the impact on students? Just let me tell you this, because I don't think it's really been felt yet. I was reading an article by a guy by the name of Dworkin. He says there's evidence that high-achieving students placed with burned-out teachers achieve 20% less over the course of a year. Another colleague of mine, Ken Leithwood in Ontario, says in Ontario right now, 20% of teachers are affected by students, so which probably means 20% of students are affected by burnout, trying to hurry it up. And I've recently read some work by Linda Younghusband here in this province that talks about some of the impacts of stress and burnout on teachers. Let's move through them. Some myths there. Big is better, not always in education. More efficient equals more effective. I don't necessarily agree with that. It's possible to do more with less. Do you know any doctors and nurses and health professionals who can do more with less? I don't know them. Downsizing to prosperity. We're still waiting for prosperity. We've had 10 years of it. No one I know of in the system will talk about the prosperity that they're experiencing right now. A shared vision. Everything that you read in the management literature today talks about the importance of having a shared vision to move forward. And a shared vision is not handed down from above. Some of the realities, I think you can read through those. The opportunities, and I'll go back to a point that Joan made. I think one of the opportunities right now is in terms of school districts need to adopt a policy governance model. I do agree that I don't think it's time right now for us to be involved in the administrative aspect of school boards. I think that's a time that's come and gone. I think that we have to adequately resource the system. I think the provincial government's sitting on a potload of money up there that they don't know what to do with it, and if they had sense enough, they put some of it back into education where it belongs, and I honestly believe they have way more money than they know what to do with. And finally, I think we have to include the community in that. And Joan Dawe said it well back in 1952. And I'll leave you with that, and thank you very much.
Thank you, Dr. Dibbon. A very comprehensive overview of the education sector and the implications for regionalization. Next speaker is Kelly Vodden, who's a geography PhD student at Simon Fraser University. Her PhD research is involved with multi-level collaborative governance in Canadian coastal regions, including regional economic development boards and watershed management organizations in Newfoundland and Labrador. More recently, she has explored examples of regional cooperation in the field of municipal government, in authoring a series of case studies on behalf of the Newfoundland and Labrador Federation of Municipalities Community Cooperation and Resource Center. So I now ask Kelly to come forward.
Great, thanks. So as David told you, I'm here to speak to you about two areas of regionalization: economic development and municipal government. Not two small topics. Also two topics more closely related than you might think at first, particularly as municipalities are gaining more capacity in the field of economic development and getting more engaged. I also want to talk about regionalization as an ongoing process and as a multi-layered process, and the complexities and the implications of that. Starting out talking about the evolution of regional economic development in Newfoundland and Labrador. People first started talking about regional economic development really in Newfoundland and Labrador in the 1990s with the introduction of the regional economic development boards. The first point that I want to make, which many people are very well aware, is that there was regional economic development occurring before the regional economic development boards. There were 59 rural development associations, which were in fact regions. They were associations made up of multiple communities, and even municipalities that were made up of multiple traditional communities. We're all trying to forge a new identity, a regional identity, a collaborative new identity, and trying to work on social and economic development prior to the introduction of the regional economic development model. Nevertheless, there was agreement that there was need for coordination and for a bigger picture view as well. So the regional economic development boards were created, and I've listed here the 5 aspects of their mandate, creating and overseeing the implementation of strategic economic plans, coordinating business support, supporting communities and organizations in development, coordinating social and economic initiatives, and I've got that in italics for a reason, relating to regional economic development, and public education and participation. Also, the boards were to answer to 3 different levels. They were to answer to the community through their boards, they were to answer to the province and the federal government, their funders. So there's been mixed success, for sure, in the regional economic development boards in accomplishing these 5 aspects of their mandate. And right now, the boards are going through an evaluation process, several evaluation processes, in fact. Self-evaluation by the boards themselves. COA has gone through some reviews of the Regional Economic Development Board process, and now there's a new process initiated by the province. Well, not new, it's been going on for a while now, but initiated by the province, but with other players involved. So it's a time of reviewing what we've learned and the successes and areas for improvement. Some saying if there can be improvement, some saying how can we improve the Regional Economic Development Boards. So in 1995-96, we have these new boards and a new vision for how regional economic development is going to happen in the province that includes looking at social and economic development in an integrated fashion, at least to some extent. Then in 1998, we have the Strategic Social Plan created by the voluntary sector as well as government players, and the idea that this will be rolled out on a regional basis starting in 1999, I believe. And this had 6 regions, the Strategic Social Plan, and councils in each, and was also supposed to address social and economic development issues. Now, also the regional councils were made up of both government representatives and representatives of these existing regional boards that we've heard about, including the economic development boards, but also from health and education. So there was an integrating of these different forms of regionalization through the SSP. The problem is that for the Red Board perspective, they weren't exactly sure how they were going to engage with these new regions and with these overlapping, at least to some extent, mandates. And it was handled in different ways and across the province. Some Red Boards were quite involved in the Strategic Social Plan process and others were not. Another feature that I want to just highlight is that there was an evaluation process built into the Strategic Social Plan process, and I think that's important because the Regional Economic Development Boards, after years of questioning, are now finally going through this evaluation process after 10 years, whereas the Strategic Social Plan had a 5-year review process built into it through the social audit. Then, in 2004-2005, we have the introduction of the Rural Secretariat, replacing, from a regional perspective anyway, replacing the Strategic Social Plan. Some in government will say it wasn't a replacement, it was building on, recreating other words. But from a regional perspective, the old councils were gone and the planners were gone, replaced with a new structure. And there were 9 regions instead of 6. So if people weren't clear before exactly how the different kinds of regions and boards were going to interact, then things became even less clear. Again, there's some overlap in the mandate, developing regional approaches that link economic and social issues, but also bringing cultural and environmental into the mix. There was supposed to be similar between SSP and the Rural Secretariat coordination at the provincial level, and also some degree of coordination at the regional level, although how it's all going to roll out at the regional level is still unclear at this point, because of course the councils and planners have just been put in place. So the point that I want to make is from the regional economic development perspective, there's new layers, new players, more uncertainty. So here I've listed the 3 different types of regionalization that I've talked about here. And it's a simplified diagram with the boxes being so separate because there are certainly some linkages between them. As I said, there was a spot on the regional councils for the regional economic development boards, and certainly the Rural Secretariat has promised to build on the work of the Strategic Social Plan, so they're not completely isolated. But nevertheless, the relationships between them are unclear. Things like where are the differences? I've heard the comment from representatives from the Rural Secretariat that we have different mandates. We should be able to cooperate and not compete because our mandates are different. Perhaps, I agree, there are definitely differences, but those differences have to be made very clear to people. And there are also overlaps that we can't deny. Just in the language that I've highlighted here, social and economic development is a part of every one of these structures' mandate. So there needs to be a dialogue about how people are going to work together where there is this overlap. And the other point is that there's some concern, not only confusion about mandates and roles and responsibilities, but concern that it's a movement from from bottom up to top down decision-making and planning, where the economic development plans were made, for example, by the community and the 20 strategic economic plans with the rural secretariat in the 9 regions. The other point I wanted to make is that there were also 9 regions that were supposed to develop regional economic development plans through the regional diversification strategy, but not yet clear how the 20 strategic economic plans put together by these community-based boards are going to integrate with the 9 economic development plans that are going to be created by the province with consultation from the community. One's a bottom-up plan and one is a top-down with consultation. So there's concern there that the shift has went from local effort, coordination at the local level with support from above to more focus on what's happening at the provincial level. And this has happened at the same time as the boards are going through the review. So that adds more uncertainty to it. And after years of waning support, rather than having a 5-year evaluation process, for example, and saying these are areas where we can improve, move forward, adapt, instead there's been 5 years of waning support from the very agencies that created the regional economic development boards. So there's uncertainty from that, there's uncertainty from these new structures and how they relate to each other. And there's stress in the regional economic development board system as a result of that. Staff that have left because their jobs are not secure. And that's the danger there, if it's not happening already, that it will, if the evaluation doesn't result in a renewal, of a downward spiral, where you lose more energy, more capacity, more support, unless it's addressed. But again, I think that this period of evaluation is an opportunity to stop that from happening. So here we have a kind of picture of what we have in regionalization in economic development in Newfoundland and Labrador. It's very complex. This is a very simplified diagram. This is only some of the vertical layers, and there's regions. Of course, Stephen mentioned some of the regions that are more cross-border, Atlantic Canada, that sense of region, moving right up to the municipalities, as I've said. And the economic subzones, which I think is notable. We had RDAs before. Not surprisingly, many of the zone boards have realized that there's a role for that more local level and have started to work at a subzonal level. Not surprisingly, similar boundaries to RDAs that were already there. Okay, so and we also need to look at horizontal linkages between these levels as well as vertical. And so this is a multi-level governance is what we're talking about. How do we manage governance within these very many different layers? So I just want to quickly touch on options for municipal cooperation. Again, it's been a long-term process, regionalization in municipal government. We had, in the 1970s, we had the joint councils that were created where different governments would sit together to decide to talk about common issues. We've had amalgamations since the 70s and before. We've had the St. John's Metropolitan Area Board. So Stephen mentioned the 1997 task force, but the regionalization and municipal government discussion has been going on a lot longer than that. But recently, with rising costs and reduced tax base and reduced funding, there's been a President's Task Force on Municipal Sustainability by the Newfoundland and Labrador Federation of Municipality, and also the creation of the Community Cooperation Resource Center to look at how regional approaches might be applied in Newfoundland and Labrador. Just a couple points on that. First is that the research that I've been engaged in with the Community Cooperation Resource Center shows that most municipalities in the province are sharing services with a neighboring municipality in some way. But it's a wide variety of different approaches, and that's the service sharing arrangements. It's voluntary and it's flexible. It's different in different places, what they're sharing and how they're doing it. What the President's Task Force discussion paper recommends is a flexible approach. Recommends that, first of all, the issue of not enough funding out there to support the municipal system be addressed, similar to education. First of all, get the resources there, then let's talk about the structure. And second of all, that once that issue has been addressed and flexibility needs to be part of the funding question as well, that each municipality would be able to assess its viability and look at these options. It might be the status quo because the municipality is fine as is. It might be that they need to work more closely in sharing services with neighboring municipalities, and it might be that they need to amalgamate or form some other form of regional government. Regional government is part of the solution, but it's a flexible approach, and it's a voluntary approach, and it's an approach that also recognizes existing communities. Rather than replacing them with a larger structure, it would be multiple communities in a regional structure. The question that I want to ask out of the lessons from municipal government is, they're looking at a structure that's at varying structures across the province. Regionalization in municipal government doesn't look the same across the board. Might we be able to ask that question, whether that sort of flexible model could be applied in other sectors? So these are some of the issues that this discussion and looking at regional economic development and municipal government raises for me. First of all, there's both place-based and there's functional regions. We've talked about functional regions, really. But people have a sense of where their home is. That's a region, too, and that's important. We know that from research in sustainable development and community development. And that can only be so big, that sense of home region. You can only push those boundaries so far, and we need them both. So we need to accept that there are many types of regions out there and that the picture really is complex, and work with that. Also, balancing change and stability. David mentioned that. This rapid change rather than a planned change where we've learned from our experiences, we've tried to adapt, and then change the model if need be. That is more of the model, I guess, that I would propose, which is closer to the incremental approach, I suppose, than the Big Bang, unless there's a collaborative learning that says we need a Big Bang. But anyway, rapid change for no apparent or understood reason certainly creates a lot of tension. It also makes people feel very undervalued, volunteers that have participated in past processes and have been replaced by a new model without understanding why. Also, just the point that when you add a new layer, a new type of region, you're not really replacing, in the case of economic development anyway, you haven't replaced other smaller regions. You've added a new layer. And there may be a need for both levels, but certainly the old level is still there. Planning temporal, vertical, and horizontal linkages. We have to work at trying to define the linkages between both past and present structures, moving up and down these types of regions, and also out horizontally between economic development, between health, between municipal government. Because regionalization of municipal government has an impact on regional economic development, and vice versa. Health, one of the stories I heard in the municipal government was that the schools being consolidated helped create a sense of regional identity, which helped facilitate regional economic development and regional government initiatives. So they're very much linked. The last point is that we need to realize that we do need to look for cost effectiveness, cost efficiency, but also that that can come at the cost of effectiveness, which is really what matters. Are we getting the job done? And also that regionalization is not always more efficient. In some cases it is, and some it isn't. And we have to ask the question, accountable to who? There are multiple levels of accountability, I think, that we need to have in this multi-level governance system. Not just accountable to the province or to the community or to the federal government, for example, but multi-level accountability. That's it. Thanks.
Thank you very much, Kelly. We've now had the broad sweep covering the impact of regional devolution on economic development, municipal government, health, and education. It's now time for audience participation, because we're now going to enter into a question and answer period. But I would like to ask you to join with me in extending our gratitude to the panel for the presentations, excellent presentations that have been made just now. So would you please express your appreciation? Before asking the panel to move up to the front, to the chairs for the question and answer, I'd like to introduce Dr. Robert Greenwood, who is the director of the Leslie Harris Center of Regional Policy and Development. The Leslie Harris Center has been in place now for just a little over a year, and Rob came to Memorial a little over a year and a half ago from Saskatchewan, having previously lived in Newfoundland and occupied a number of senior positions in the province and in the university. and he's now back in Newfoundland, and he's going full steam ahead with the Harris Center. And so Rob is going to be the moderator for this next session, and I now call Rob to the podium and ask the panelists to move to the front.
Thank you very much, Dave. Got paper coming at me from all directions here. A lot of material there to digest, but a lot of people here who certainly come to the table with a lot of knowledge on this already. And I'm sure watching at home and on computer and on cable. We have some questions coming in already. Dave Vardy is going to receive them as we go. Please move to the mics in the hall if you would like to ask a question. I have tried to inflict time cards on the speakers, and they've been pretty good. I will use them on you too. Please bring your questions to a point. We have a lot of talent at the panel table. I will ask the panelists also to be brief to get through as many questions as we can. And I think if anyone does have questions at home, you can email to research@mun.ca. And if anyone would like to move to the mic, please feel free. And I do have a question here already from Don White. And I'm not sure if it's a comment or a question, so I'll tell you what he says without any previous editing. The path of regionalization, like Red Bees, can be viewed, that's the zone boards, can be viewed in some ways like creating another level of government between municipal and provincial, but often without the core competencies. For many regions, boards are faced with increasing responsibilities, but have limited resources, both financial and human. In many regions of the province, there is a limited human resource base to draw upon to provide directors for effective boards. Can you comment on or add some insight to board composition and its effectiveness? That is, would Red Bees be better served by having directors based on value add rather than having directors because they represent a formal stakeholder group? Thanks for considering this point question. Hopefully it is not too long. No, I just read it, so it wasn't. Maybe we'll let Kelly have the first crack at that, and then I'll open it to the other panelists if they would like to comment.
I guess I'd first like to say that certainly red boards have been expected to do a lot with a limited resource base, so that observation is fair. And it's been part of the challenge right now to one of the solutions has been to get red boards to focus more on strictly economic development and dropping some of the other things, more socially related initiatives, for example. So I guess one solution is to do less with less, but I think that would be heading down the wrong path. So a shortage of resources is a reality, and I think there's a lot of complex problems there, including changes in HRSD and other things. So certainly more resources would be better to accomplish the job. The second point about the boards, I can see the point about not having representatives to fill a certain spot, and I think that I could see the effectiveness of having some open positions for people that have energy but don't fit those particular slots. At the same time, I think that there is a real role for those positions, whether it's representing municipalities or representing the community business development centers, et cetera. Those linkages are important to other organizations, and having those spots there are important for that reason. So I think a combination perhaps of some open positions and positions that represent certain segments that they want on their boards, those positions might sit empty if there's not an appropriate representative.
Thanks, Kelly. Other members of the panel like to weigh in on that in terms of zone boards or in terms of appointment on other types of boards?
I guess a couple comments. One, I guess, is related, obviously to capacity and autonomy. There are questions that get raised about whether all the regions should be treated the same. Obviously living in St. John's has higher costs. Maintaining and recruiting people, it's a challenge. So for health authorities, should they all have the same budget, for example? Or should regional development boards have the same budget, because setting up an office in St. John's is higher than it is in many rural areas. So that is part of the political problem. When it comes to stakeholder representation, I mentioned with health authorities across the country and regions, there's been some discussion about whether doctors should be part of the structure, because of course they're very much part of the process, and there are quite different views on whether that should happen because of some of the fear that they may end up dominating the regionalization process. The challenge or problem is that many of these regional structures have allowed the doctors kind of operate, you know, around the boards, or kind of have a level of autonomy and independence, in the sense that they are not controlled by the regional structures in ways that some would wish they were. And in terms of regional development boards, there has been challenges and problems with having business people sitting on the boards as well. And again, there's people I think would prefer to have them there, but there's been a bit of a reluctance on the part of some of the business community to actually participate directly in this process or mechanism, because of course they're busy anyway, and they have other priorities, and they're dealing with market realities and all of that. So again, I think that would enhance or probably strengthen the role of the regional development boards if we had some of these stakeholders participating. But I think there has been challenges associated with recruiting them and getting them to do it.
Other comments, Joan or Dave?
No. I think I already made my comment on the importance of engaging the community through trustees, but that people truly understand the significance of the mandate. They know that before actually they accept the positions, because it requires the knowledge and expertise and a commitment to do the job, and it's a fairly heavy commitment today.
Thanks, Joan. Dave, were you?
I'll pass it on.
Okay. And we do have, I didn't mention, if you could please introduce yourself when you do ask a question. And up here on my left.
Stefan Yevchik, City Planner with Mount Pearl. It's a question, I guess, to Kelly and maybe to Steve as well. In recent times, the province has given municipalities the right to do a lot more economic development activity. Just wondering, in your research with economic development, Kelly, did you see any change in relationships between the municipalities and the Red Bees in terms of the economic, I guess, connectiveness and initiatives between the two, given the fact that you now have, in a sense, competing mandates between the municipalities and the Red Bees?
Yeah, like all the other structures, there's potential for competing. They could be competing mandates, or they could be complementary, where they now have the opportunity to work together. So, and people really, in the municipalities that I met with, they really had a varied perception of that. In some cases, the municipalities worked really well with the Red Bees and recognized they needed to build capacity, particularly in the areas, the communities that were smaller and didn't have their own EDOs and things, where the Red Boards really helped bring capacity to economic development committees, for example, by doing training or really functioning almost as an EDO for them in some ways. So it was very diverse across the province. And in other areas where they're larger centers with their own economic development staff, they were talking to one another, but really, I wouldn't say competing by any means, but not supporting each other, certainly, as well as some of the smaller, mostly smaller communities, but not only. There were larger, Port aux Basques, for example, has worked, well, it's not larger relative to some of the communities that I was in, but the centers, some of the centers have worked really well. And even in Gander was another area that I looked at. The Gander Economic Development Office has worked with the Red Board on some of their business attraction initiatives and that kind of thing. So it depends. It's really varied across the province.
Thanks, Kelly. For the uninitiated, EDO is an Economic Development Officer. We have a whole set of lingo in each of these policy areas. Steve, did you want to weigh in on this one?
I can add, I guess, much more. You know, as I said, it depends on the circumstances. It depends on the people in a particular region. Some of the interviews we did and we're studying the regional development boards, we had people in local government saying, well, we've been doing this for a long time anyway, economic development, that we now have the power that we're doing it, but we did a lot of that before. It may be a problem having competition. Again, part of, I think, what we're trying to do tonight is to show all the various structures that have been built and processes, and we need to better understand how they're linked, how they're grouped, how they're organized. Are they cooperating? Is there an incentive to cooperate? Is there incentive to compete? I mean, we do have regional boards where we have, you know, Mount Pearl and St. John's sitting together. working supposedly together on the problems of the region. But again, you don't always see that reflected in terms of municipal politics. There's a potential for it if you had the right dynamic and people who were interested in doing it, who understood it. It may make things, may improve things. But again, whether cooperation is better than competition also, I guess, depends on one's theory or one's framework.
I'm going to go back to the floor, to the gentleman on my right. And if anyone wants to ask a question who can't move easily to the mics, they are mobile, so put your hand up and we're happy to come to you.
Yes, my name is Nick Hurley. I'm with the Provincial Association for Community Business Development Corporations, but which is we have 15 members who give loans to small business, but that's just who I am. But my question is, and I don't know who to best ask these to, maybe Kelly or Dr. Tomblin. Has there been any evidence, or have any, your research has shown any places where there's linkages between, like we have education, we know the linkage between poverty and health, for example. We know the linkages between economic development and education. And have there been any jurisdictions which have attempted to create a body which would make your approaches more integrated? Because I think, as was referenced, I think, by Stephen earlier, there's a lot of silos here. And there should be a better approach, a more integrated approach to doing this. And I know the legitimacy of the boards, whether you're appointed or elected, and whether I know they all have mandates, of course, which seem to be so focused on themselves, if well, and getting the job done within, that the macro picture is probably suffers because of that. And the end result, of course, which is the creation of a good economy, if you will, and a good health system, and a good educational system. I think that's probably a byproduct or a negative which comes out of all of this. And I was just wondering, has there been any research or any places where this has come together in a better fashion than we seem to be doing it here, if you will?
I think that's probably one any of the speakers might like to wade in on, but I'll start with Kelly, because Nick said Kelly.
I don't think in terms of structures, but I think in terms of projects, there were some interesting things that went on with the SSSP. I'm thinking of the schools project that I heard about on New World Island, where they were bringing together issues of education, empty structures that from closed schools with new schools, and how they could use that for recreation, for helping to retain youth. How the old schools could be used for economic development. So that was a neat project in terms of, but it was a project, not a structure process, ongoing process. But so there were some things under SSP, I think, that got towards where you're talking about. The other initiative that's one of my case studies that we didn't talk about other areas, but is the Sustainable Communities Initiative in Nova Scotia, which is a pilot project, and it's been attempting to do that as well. And it's the sustainable communities, trying to work towards sustainable communities in a broader sense. And so they have a committee in pilot areas that address all of those various types of dimensions of sustainable communities, supported by another committee at the provincial level that has higher level government officials there to facilitate those initiatives. So the Sustainable Communities Initiative in Nova Scotia, perhaps. But
I'll work to Kelly's left. I'm watching Dave very closely to hope he nods off, and then we're all going to be bought a drink, as he promised earlier, but he hasn't done yet. Dave, did you want to?
No, that's really not my area. I'll pass on that.
Yeah. Joan?
Well, I think, Nick, you're talking about population health. That was really essentially my message this evening, of the importance of recognizing the interrelationship between the economy and education and lifestyle and health. You know, if we are, and we truly believe we want to create vibrant communities, then we need healthy, educated people to do that. So I'm hoping that an offshoot of tonight is indeed what you're talking about, the opportunity for us to collaborate across the sectors to really influence the well-being of the population of the province. And when I speak well-being, it's not the health well-being, but the overall well-being, which means, as I say, a healthy, educated community.
I think part of the problem is the political cycle. If you look at kind of the experimentation, it's been various premiers with different visions who have to sell And of course, what you don't create this kind of integrated discourse, having all these things kind of pulled together with some coherency. There's a lot of problems, I think, associated with that. Have other jurisdictions done a better job? There's lots of places that have done the same thing. If you go to Cape Breton, we did a study on Cape Breton governance, and you'll have the same challenges or problems. The problems of Quebec has, I think, done more in terms of trying to integrate health with social welfare and environment and so on and so forth. There are other jurisdictions around the world who've probably done a better job, but that requires, I guess, a leader that is in power for a while, and that there is an actual public debate and opportunities to kind of pull together to see if there is some logical way of addressing issues or problems and having a shared map. But as I said, I think many provinces across the country, in part because we have 3 or 4 year cycles, have experienced similar problems, and we have federal and provincial regions that are established and sometimes competing with one another, and that creates even more confusion, and it makes it more difficult to engage the public or make them feel positive about some of the outcomes. So we just don't know the impacts because, again, this is a very complicated web, and I think part of what we're trying to do tonight is figure out, is it working, is it good, what areas of public policy is it working? If it isn't working for education, how could it be improved, or could it be consolidated? Could it be centralized? Are there things that we could do to make it better? What kind of things we need to do in order to integrate? To what kind of training is required? What kind of capacity is necessary? These are, again, things that probably need to be debated, and I think in the past haven't been.
Thanks, Steve. And up to my left.
My name is Vivian Randall, and I'm a retired public employee with a long-term association with the issue of the strategic social plan and some of these other ideas. Just to comment more than anything, I think one of the areas that I feel was very important to the process was the issue of knowledge diffusion and transference. I think we had within government during the 90s a growing sense of desperation in terms of the crisis that we were facing as a province. I remember working in the area of social assistance. 1/4 of our population was dependent on some form of income support. 1/3 of our children under the age of 5 years lived in families who were on social assistance at some point during the year. Those were the issues, I think, that were very concerning and really drove many of us to say there has to be a different kind of dialogue. And one of the things I'd like to think, despite the amount of change, and I can appreciate the impact on practitioners such as educators, as was mentioned earlier, I think it was absolutely necessary to promote the dialogue. And I think as a consequence of the work that was done and continues to be done, there is a better social and economic dialogue, both within government and within the province, than there was before. I think there is a better understanding of some of the issues that we face, the urban-rural challenges. And I really feel there has to be, if there is confusion, I think that's okay, because I think there has to be far more discussion of the issues. We continue to face challenges. We continue to have a crisis, an aging population. And until we as a province begin to come to grips at the local level, at the regional level, and at the provincial level, I think we're going to have a really difficult time trying to deal with this in the future. So an observation more than anything.
Thank you very much. We have a question coming in the door. Did any of the panel want to comment on the statement we just heard? Very briefly. Okay. And if you are at home and you would like to put a question to our panel, we have a dedicated member of our team sitting at a computer waiting for your question. research@mun.ca. So I'll turn to Dave if he's ready, and then I'll come up here.
For Dr. David Dibbon. Question is, it's from Victor Cassell. How is it possible for the public to be more reactive, more proactive, rather than reactive?
We have to be working and living in a collaborative environment in order for that to happen. And I believe that from an education perspective, it needs to happen in that districts need to be very supportive of schools and communities, and governments need to be very supportive of districts It's almost like a tri-level model of support is about the only way that can happen. Is there's a multi-layer level of support throughout the system. So.
Thank you, Dave. Up to my right.
My name is Sheila Lee. I just happened to discover by accident this evening about this forum. I'm from a rural community, a small rural community, Riverhead, St. Mary's Bay. In my heart right now, the two burning issues is the educational one and the health one. Being a retired teacher, I guess, would explain the educational one, and realising that from point A to point B, there in a distance of 1 hour driving, we have 3 schools right now that are probably 1/3, if that, full, and the massive challenge that's there now as to what will happen down the road with declining enrolments. I guess the health one is the one that's most pressing to me now, because we've had a lot of struggle with trying to get and maintain a doctor in our area. And next week we have some of what I call the big wheels coming to our community to sit down and talk to us. So, like Mr. Tilley and Dr. Williams and Faye Matthews. So I'm really, pleased to hear the expression here this evening that we have to reach the community level. I guess the comment I want to make is one size does not necessarily fit all. And I'm just wondering, in regards to the educational problems and the health problems, is there consideration being made, and maybe it's happening and I'm not aware of it right now, over a period of time of having, in addition to looking at the whole picture across the province and across the regions, is there possible also to zero in on sort of, what would we call them, special studies, I'll call them experimental process. Like we have ideas, for example, I'm part of a group now that has thought about and prepared a paper to give to these and to discuss with this group who's coming next week. If the answers to some of those questions are, this is not in our policy, sorry, we'd like to help you, but this is not possible, then I'm going to be very disillusioned, because I'm hoping that this is going to be an open-ended process now, and there's going to be lots of flexibility, and what they may be able to do for us may be quite different than what would need to be done from someone else. So what the question I guess I'd like to address to the lady here, Ms. Dawe, who talked on health. You mentioned about the important, like you have trustees now, okay? I know for a fact that probably one or two of the people I know myself personally. But I wonder, like, what is the plan in those trustees getting the message out back into the communities? Because I think no matter what area we're talking about, there's something really breaks down there. Right now, I wonder how many people really know there's even a trustee appointed that's in the area, and I'm sure 99% of the people don't know what it's all about. Is this person going to be, as part of the mandate, is this person going to come back to the community or the region, and are they going to try to engage dialogue? Are you just going to listen to what they have to say and what they think, or are you hoping or going to expect those people to really get to the grassroots and indirectly bring back the message to you? Thank you.
Thank you. And Joan.
Thank you very much for the question. Let me go back. There are 18 members appointed to the board. With a policy governance model, these 18 people speak as one voice. So individuals who represent communities around the region are not going to be responsible only for that community or a set of communities, okay? The board speaks as one voice. So to go specifically to your concern, the intent of the board, and I think we've demonstrated already in the last 6 months, we're working our way around the region. We're holding our board meetings throughout the region. We have commenced the first major initiative, which is a needs assessment for the Burin Peninsula area. This is the beginning. This is an opportunity to clearly map out the needs, the health needs of the people in the whole Burin Peninsula area. So we bring together all the data that are available and the information and engage the community in providing input to us. It is, actually, we've advertised through the media expressions of interest for people to sit on an advisory committee to oversee this needs assessment process. So I guess to go directly, we are looking and will be working with communities and finding ways to engage the community in the dialogue and the discussion. It's not going to be left to an individual trustee, because that's not how the governance structure works, okay? It's not fair to that person to have that mandate. We feel that 18 of us have the responsibility for the full region. So that's how we're going to operate. So sort of stay tuned. We will be coming and be visible in your area as we are throughout the region. And we've begun the process.
Thank you, Joan. And we do promise folks we start at 8 and finish at 10, but there's one solitary soul there wanting to get a final question in.
Craig Pollitt, I'm the Executive Director with the Federation of Municipalities, and as Kelly alluded to, I'm in the middle of writing a report on regionalization in municipal government. There's not enough coffee in this building to keep everybody awake for the questions I have, so I'll try to limit myself to two. Two of the perspectives we had tonight, it seems to me, were regionalization of fairly large organizations into larger organizations based on trying to capture administrative efficiencies, I think is a fair statement. In my world, in our world, we're looking at regionalization as a perspective or as an outlook as opposed to a structural approach, probably. Regionalization of very small units into slightly larger collections of units based on more efficient, more effective democracy, more efficient delivery of services. First question to all the members of the panel, are there lessons, given those differences, are there lessons, and what are they, from your process to our process, from this large to larger process in to our sort of more ground-up process? Secondly, I'm wondering about your perspective on what's the possibility for real devolution in our system, in our political system. If we're talking, several people have mentioned devolution. Really what we're talking about is decentralization of administration in a lot of cases. What's the possibility of real devolution with real authority, with real autonomy, with access to your own independent resources and legitimacy in terms of the people you represent?
Federation looking for free consulting here. Prime opportunity. I will ask our panel to be brief and succinct with a critical response on that. Steve.
That's a key question. It will depend on the capacity or the ability to pressure to change the system to create that autonomy and independence. So, you know, it will depend on, I guess, the power of those who are able to defend the status quo and those who are able to oppose it and demand it and pressure for it. And again, your guess is as good as mine how far that kind of contest or that contestation can go.
Joan?
No, I'll pass.
Dave?
Just to comment with respect to education and what happened with the consolidation process in education. And as critical as I may have sounded earlier about the whole consolidation process, I would be a person who would be on record of saying that I don't think the province needed 10 school districts either. But I just don't think that the consultation occurred at the community level. I think that there were opportunities, had communities been involved, that they would have formed their own regions, and that would have been much more powerful than having it mandated. And I think the leverage in that would have been, I mean, it would have lasted a long, long time.
Thanks, Dave. And the last word to Kelly.
Yeah, I don't have a lot to add, especially on the question about moving from big structures to bigger structures, because I think that where I've looked at municipal government is where you're at, and also even the zone boards compared to these larger structures are smaller. We're talking RDAs and municipalities to zone boards, so it's on the smaller end. But on the devolution of true power sharing, I guess, that question, that's a tough one. As Stephen says, it depends how much people push for it, and I think also show that they really want it, and also that they're going to exercise that authority when they're given it in a responsible way. So these questions about people not participating in boards, losing faith, that I think that our ability to show that we really want more say and that we can take more authority and responsibility, we can lose that easily because people become disillusioned with processes. So this confusion, this lack of debate, this lack of involvement in regionalization, I think we're losing some of that enthusiasm. So the danger there is that authority will never be passed down, because the higher up levels will be able to say, well, you haven't been able to step up to the plate when you've been given a chance. So I guess just keep pushing, but also not let the opportunities that are out there now be used against you as examples of failure.
Thank you very much. Great discussion, and I'm sure there's lots more that will occur in the reception after and in our province on these issues in the days and weeks to come. The Harris Centre is dedicated to stimulating policy debate and discussion. We want to leverage the resources of the university to contribute to that. That's why it's called Memorial Presents. But we also want to provide neutral ground for perspectives from different stakeholders. And so we will have a continuing series of these Memorial Present sessions. I think regionalization is clearly a critical issue in the province. It cuts across a whole series of policy fields. It's about geography, it's about service, it's about integration, it's about democracy and accountability. And I think Joan's comments about the governance model and needing to move to policy governance from administration is a critical lesson for all the players. I hope we've informed the discussion in this critical area, and I also hope we've raised more questions. And I'd like you all to join with me in thanking the panel and Steve for a great series of presentations. I would also like to thank University Relations for a great job in helping put this together, Distance Education Learning Technologies for the assistance in the broadcast, the Total Group working with the Harris Centre, and the staff of the Harris Centre. Thanks to Dave for opening up our session and trying to keep our panelists on time. And most of all, of course, I'd like to thank people in the audience at home, watching on computer and on cable, as well as you folks who voted with your feet and came out here tonight. There's a lot of competing demands for people's attention, and when you vote to come out and participate, that's what a democracy is all about. We do have a reception just outside the doors here afterwards for those of you in the hall. Unfortunately, we can't beam that out. We do have evaluation forms in your kits and on our website. Download them, fax them in, email them in. We also welcome suggestions for the future. There are pencils in a box outside if you don't have one. Leave them on this table here. You can't go home until you fill one in. And thank you all very much. Good night.